take you to Sarah. She's going to precept you for the next couple of weeks, and you'll be following her around. Miss Sarah.
Hi.
Hi, this is the new nurse, Stephanie. She's going to be following you around for the next couple of weeks, okay?
All right.
All right, thank you.
How you
What are you
doing?
doing over here?
I'm just looking up patient information, getting ready for the shift, and yeah. So, did you just graduate from the RN program?
No, I actually just graduated from the LPN program over at Ivy Tech. So,
Oh. LPN?
yeah.
Oh. Okay.
I don't know what just happened. Good evening. Hello. You doing alright? Alright, well, we're a little busy today, so I'm going to be your LPN today. My name's Stephanie. I'm just going to do the initial assessment before the doctor comes in to see you, okay?
Okay.
I just have a couple questions to ask you. What brought you in today?
I'm having a sharp pain in my chest.
Okay, and when did it start?
Yesterday.
Yesterday?
Mhm.
And did you do anything that relieved it? Did it not go away? Medications?
I didn't do anything.
Okay. That made it worse?
I don't think so.
Is it like a burning, stabbing?
Excuse me? You're an LPN, you can't do initial assessments?
Oh, I just figured since we were so busy that you had a lot of workload.
No, that's not within your scope of practice. That's inappropriate. I am so sorry.
Oh, okay.
Hi, Miss Camille.
Hi,
How are you?
I'm well.
I'm Cassie with Ivy Tech Hospital. I have a couple of nurses who I really think could use some advice from you.
Okay,
And
okay,
there's been some conflict regarding scope of practice.
okay.
And maybe your specialty would be.
Okay, wonderful. Yeah, bring them on in.
Okay, thank you.
You're welcome. Good evening, ladies.
Hi.
Hi. Hi, Stephanie. Welcome. I hear you're brand new.
Yeah.
Is today your
graduated
first
from Ivy. Well, it's been a couple weeks now, but
Wonderful. So how do you like it here so far?
well, I feel like there's just been a lot of issues with how the RNs are treating me because I'm an LPN.
Okay. Can you give me some examples?
So, well, the very first day, my preceptor was just really rude when she found out that I was an LPN, and then second time is I was doing initial teaching.
You can't do initial teaching
I know
as
that
an
now.
LPN.
I know that now. I know that now. I just figured you guys were so busy that I would try to help, and I know that it's not my scope of practice. But what harm is it going to do?
You're gonna get us sued. You just graduated as an LPN. They don't teach you that as they do in RN training.
This is it.
It's
They
unsafe.
just think they're so much better than
Sarah.
LPNs.
Well, I understand what you're trying to say. I think maybe we could say it in a better way. This is not constructive. I think we could definitely be more constructive, especially to, our new hires who we want to embrace. And we can teach them and let them know, what's supposed to go on without having, negative attitudes about it.
Okay.
So, Stephanie, I'm so glad that you're here. And, I hope this can be a great learning experience for you.
For me, it should be a learning experience for her.
And for everyone.
There needs
because
to be a line drawn about what an LPN can do and what an RN can do.
Wow. There are
Listen, I
different-
would not have to do follow-up teaching if my RN did really good initial teaching.
Stephanie, and then that is also not constructive, and it's not true. It's good for us to repeat teach to our patients, our clients, over and over to make sure that they understand what it is that they need to do. Initial teaching is important. Follow-up teaching is equally important. The scope of practice for an RN is important. For LPN, it's extremely, it's important as well. They're both equally important. We have to be a team. We have to help each other. And if someone has a misunderstanding about exactly what is in their scope of practice, we can educate them.
So can we go over what the scope of practice is for an LPN?
We absolutely can for both an LPN and an RN. Absolutely. Stephanie, do you have any questions about what it is that you absolutely can do and you cannot do?
No, I think I understand. I was just trying to help.
Can you give me some examples?
We can't do initial teaching. We can't hang blood. We can't do initial medicine through report. We cannot do initial assessments. The RN has to do all of that stuff.
that's wonderful. Those are great examples. And when, there are times where you may forget or you feel like you can do something because we are behind, we are busy. But it's just important to remember that that is not your scope of practice. And in turn, you need to be available to her to help her when these things are needed. It's good teamwork. Teamwork makes the dream work.
And do the Harlem Shake.